addiction or whatever.
Nope, I'll go find him.
Julie, this is Steve. He's a therapist out there. Therapist twin. Yeah, I think it helped people. He used to be in the WRC with us.
Back in the old days.
The old days. The old days. And Julie is 18. She's saying my baby.
Hey, we're gonna just hear it.
Once a year.
Once a year.
Well,
I missed last year because we didn't have it. This year we did.
They don't hurry up.
Well, I was here at the time. I was at Shaw Clientele. I came here at 79. When I was a kid.
Really?
Yeah, I was at,
Oh, no way.
I went to the rack. Yeah. Yeah. I was never named anybody was back then.
Gosh.
There's a Jim Russell here too. That's old.
Oh, wow, that's really old.
So, yeah. No, they're all out. I don't know if they're lying. The one
The
guy.
old scandal.
I think Brown probably did. I don't know about Brown died. But I know about
What was this?
which one? Just to make sure. Okay.
No, the one from.
So, if you wouldn't mind humoring me really quick, I just want to say this is going to work. So, if you wouldn't mind just texting this and going ahead and rating your lunch.
It's 2 in the morning. She keeps going watching. Hey, come on, play.
Should have a lot of shit.
I'm sorry.
Well, now.
Yeah.
What's the home to?
My voice played.
Yeah, yeah, yeah.
Oh, yeah.
Yeah, I lived there for a while. Now it's Irish. So. Yeah, I love PG.
Yesterday's Friday morning, know that you're on.
That's my
capitalization matters.
I would have seen you for sure.
Okay, you got it.
How'd
you guys turn it on?
There was nothing available.
Here's the remote. Are we ready to go?
I think so. We're just Simon.
Okay.
Bless you.
Cool number. Good lady right here. Yes, up your presentation. Can you come up here, buddy?
Oh, yeah, come on up.
You got anybody else coming up?
No, I kind of came here to do my own thing because I want to learn more about vaping.
That's good. Well, Devin's
Okay,
big
did
time
anyone
into it.
seen this? Yeah.
He likes to vape.
Yeah, big time into it.
Yeah.
And his phone. You're big time in, I said you're big time in the vaping.
Oh, that's why I'm here.
And your phone.
I want to know how to.
They're like interactive.
Smoke off. Okay. Right, your lunch?
No, I'm not asking.
Been hoping to walk in the stairs and get a heart attack. I've been walking a lot. Like, what you
I'm not.
Instructor sleep study.
I like pulling my mask back and the breathe. This is like things where you're trying to suck in material.
Yeah, I'm not sure.
Gonna keep you going if this is.
Yeah.
Not just extra time.
Finally dead out there. Stairway to heaven.
But in a way, I'm really only doing those. That's a pretty
Still a good workout.
I have not been using myself. Maybe it'll be a reality.
You can do it. I'll take on like K-12 or K2, what is it, K2 and Everest and take on Denali or
The only other way would be.
It's the best deal time ever.
you can do
I know, because you're like,
I guess you can do it.
you guys looked up and when I work,
So one of my tools
you start to feel sweaty.
Oh, that's good.
Really? Oh, she did.
No, I'm Sarah. You were emailing your manager.
Early on, my marriage was
So, no, it's been super.
so, I don't know how I did it now, like I was just rubbing it I'm trying to expand my lungs.
Yes.
Don't like anything. Then she'll know what's talking.
That's like, oh,
She'll be like, oh, Tom's wife is talking. This will get grandkids. Kids.
But you know what?
I'm not afraid. She knocks on your
My roommates are like,
My guy's yelling.
well, I don't know what to do. So my maintenance program is,
Can you tell me what you're doing? I talked to him about it.
You're in the D wing.
You do such a great job.
like his face is great. Yeah, he's so yeah, maybe she and then I know she wrote it like she wants to go that direction at some point. To bring,
Yeah.
yeah.
She had it's an interesting.
So what are yours?
Well, Jake's in I mean, in a way, I know it's my choice to call because I can step into it. Here's pictures. Jake's outside line. Senior year tours. Alright. And then she graduated in.
All right, you guys, thank you for your patience. I am going to introduce Sarah Simons. She's been working with the Utah County Health Department for 14 years, and for the last 10 years, she's been working to prevent youth from starting tobacco use and also helping people with tobacco use cessation. Almost said sensation. Don't want that. She's also one of the coordinators of Utah County's Outrage Advocacy and Prevention Youth Group. And then lastly but not least, she's also working with Utah County schools to update and administrators to update their tobacco use policies. All right, thank you. It's a pleasure to be here. And I don't know if it's kind of weird for you to be in person again. It is for me a little bit. But like she said, I work a lot with youth, and especially this past year working with youth online. I'm trying to make things a little bit more interactive. So I tried this last week with a presentation with my youth online and it worked. So I'm not sure why not today.
So I do have a few of these slides, and since it's not working, hopefully I can get some feedback from you, and we'll make it interactive that way. So, I don't know, how was lunch? Good? All right, sounds good. Okay, you can go ahead.
Not working.
If anyone can get it to work, as we go along, and if it shows up, that'd be great. Okay, so our objectives today, sorry, I want to make sure that you guys can see this and I'm not in your way. All right, so be able to identify at least one fact about how vaping tobacco affects the behavioral health population. Feel confident accessing at least one vaping tobacco cessation resource, and be able to identify one new way to connect with your clientele. All right, so that's not even coming up now, how I even click in. So what is the first thing that comes to your mind when you think of vaping and health?
Popcorn lung.
Poor lungs?
Popcorn.
Oh, popcorn lung? Okay.
I always think when they're smoking their car, they're on fire.
On fire? All right.
Some people are really passionate and say smoking is less bad for you, and some say vaping is less bad for you, and there seems to be I've heard that debate.
Okay, yeah, there's a debate, which one is worse?
I always just imagine how it might feel sprinting to first base.
Okay. All right, that's a good way to explain it. Okay. All right, thank you for those thoughts. We'll go ahead and go on, and we're going to talk a little bit about tobacco and vaping, because there isn't a lot of solid evidence with vaping, but hopefully we can give you some answers with both today. So with tobacco, there's more than just tobacco in your cigarettes. There's over 7,000 chemicals in a cigarette. Many can damage cells and lead to cancer. Tobacco companies, they add flavors and other chemicals, and obviously that is what attracts youth. That is what makes it more addictive, and why people continue to use tobacco products. With smokeless tobacco, there's 28 known cancer-causing chemicals. It has high levels of nicotine. Now, depending on the form, duration of use, a person can take in anywhere from 4 to 40 milligrams of nicotine, and that can be equivalent to consuming up to a pack of cigarettes. All right, so let's talk a little bit about vaping. So it came in here into the United States around 2007. So we have about 4 different generations that have come now. So you have your first generation, which is disposables. So they were the ones that looked more like cigarettes. They're your one-time use. You couldn't recharge or refill, and they were designed to mimic, as I said, the cigarettes. You have your second generation, which were the pre-filled. You could recharge them. The e-liquid comes in a pre-filled, refillable cartridge, and then the cartridge was attached to the battery pin. Your mods were designed to be used multiple times and then modifiable, so that's where the mod came from, and allowing the users to customize it. So it makes it more yours and more the autonomy with it. Now we have your pod mods. So they're pre-filled or refillable pod cartridges with the modifiable system. And the most common are the Juul, and a lot of youth that's the one that they prefer to use. Okay, so what are the potential health risks of e-cigarettes? So it leads to the initiation of combustible tobacco use. It leads to relapse among former smokers. Diminishes the chances that a smoker will quit. So we can talk a little bit more about that. Discourages smokers from using proven quit methods. Exposes non-users to secondhand aerosol. Glamorizes or renormalizes tobacco use, and results in poisonings among users or non-users. So COVID and smoking. So there's been a lot of talk about that this past year. So The available scientific evidence indicates that cigarette smoking increases disease severity among adults with COVID-19. It is inadequate to infer whether cigarette smoking is associated with the risk of the COVID infection, and then further research is needed on the relationship between smoking and COVID-19 outcomes and the potential role that nicotine could play in the relationship. But it does affect the lungs, and we know that COVID has affected the lungs with many individuals. Okay, so let's talk about the indicators of tobacco use and how each piece of the puzzle is affected. So one piece of the puzzle are individuals with behavioral health conditions. So persons with behavioral health conditions and tobacco use, it greatly impacts a person with mental health illnesses and addictions. They are nicotine dependent at rates 2 to 3 times higher than another individual. They represent over 44% of the U.S. tobacco market and consume over 40% of all cigarettes smoked. They have more psychiatric symptoms, and they have increased hospitalizations. They require higher dosages of medications and are twice as likely to leave against the advice of their doctors if their withdrawal symptoms are not treated. More than half of the patients in treatment for alcohol and drug dependence die not from their addictions, but from tobacco-related illness and disease. And tobacco companies have promoted smoking in treatment centers, homeless shelters, and soup kitchens by donating cigarettes and blocking hospital smoking bans. So this is really sad, but they target towards those individuals because they look at that as the vulnerable population, and they feel like that's an easier way to increase productivity for themselves. So they have monitored or directly funded research that suggested that individuals with mental health conditions were less susceptible to the harms of tobacco, as well as needed tobacco products to help them manage their symptoms. So that's what they had individuals believing, is that if you had a mental health disorder, that you needed tobacco in order to help you to cope with your disorder. And that if you were to stop using your tobacco, then you wouldn't be able to handle your mental health disorder, which is super sad, is how the tobacco company targeted individuals. And smoking is highly prevalent among adolescents with diagnosis of behavioral health conditions, such as the ones that you see up here. Okay, so another indicator is youth. Which of the following do you feel is true about youth? Are they more likely to benefit long-term from preventative interventions, be a target of aggressive marketing by tobacco companies, become susceptible to social and environmental pressures to use tobacco, which I just realized I spelled wrong. So all of the above or none of the above? Right, all of the above, right? So, okay. So with our youth, this age group is a prime target for preventative measures. Advertising and promotion influence the factors that led directly to tobacco use by adolescents. So research has shown that adolescents are more likely to use because of the advertising, the flavor, and because of stress. Developmentally, youth and young adults are more impacted by also by their social pressure of school and friends and the environment around them. So youth e-cigarette use is rising because their brain is not fully developed yet. It can cause addiction. In 2018, 1 in 5 high school kids were vaping, and 1 in 20 middle school kids were vaping. And in 2020, you could see a surge in the disposable e-cigarettes. So, and because of that, it was easier to hide and so it was easier for them to put in their pockets and to use in the bathrooms, and then flush it down the toilet before anybody could find it.
There's smell differences, isn't there, between?
Yes, there are different, the way that they smell, and because of the fruity flavors, and if you're not sure what you're looking for, it can be mistaken as, oh, they're just chewing a flavorful gum like watermelon gum, or they just put spray on like body spray, or they have that, flavored lip gloss or things like that. Yes. Okay, so young adults, 24% of young adults report tobacco use. Most young adults who use tobacco begin social smoking during adolescence. 72% of young adults who use tobacco either socially or daily become tobacco dependent. This age group is a prime target for preventative measures. Is it just A and C or A through D? Yes, so all of them, A through D. All right. So 72%, they use socially, and then they do become regular tobacco users. And they, again, are a prime target for preventative measures. And so when you're working with them, you want to address their social use if you're trying to help a young adult in quitting. So you'll see here in the next slide some effective ways of working with young adults when you're working with them with one-on-one or as a group or as in treatment. They really like technology-based. So you can find ways to work with them that way. That is very helpful. You also need to tailor it to them. As you guys know, like not one way works for everybody. So you need to tailor it to what's going to work for them, which is through technology. They prefer if it's free or financially reduced. You're going to get a lot more young adults to work with you that way. Not only addressing the social aspect, but if they have family and friends who are willing to support them, make sure that they are included when you're working with them and helping them to quit their tobacco use. And then obviously the shorter the intervention, the more likely they are to work with you with that. So 1 in 5 young adults vape. With this, so brain development continues until age 25. And this is something that's interesting because you would think, oh, well, they're older, they would understand more. But actually, approximately 2/3 of Juul users between the age of 15 and 24 do not know that Juul contains nicotine. And many teens who start as vapers become cigarette smokers as well later on. So those of you who've been working with youth or starting to work with young adults, you'll see that they are now Juul users, or they started out socially vaping and now they're regularly smoking. So that's another situation that you're working with as you're helping them with their tobacco cessation. All right, so with older adults, true or false, is there a bias regarding older adults and tobacco cessation? You are very much, why would you say that? Yeah, why you are very much so.
It just kind of seemed to make sense.
And why do you think it makes sense?
The harder you smoke, the harder it is to quit.
Okay, all right. Any other thoughts?
I think there's a lot of the same beliefs with the substance use disorder medications. You're treating one addiction for another, especially with like nicotine gums, nicotine patches, other nicotine replacement products.
Okay, all right. So you're going through the next slide. So with the scientific literature, there's a lot of assumptions that professionals, such as like doctors, They go on the assumption that the older you are, that you actually do not want to quit, so they rarely bring it up with them. And also, most cessation programs are geared towards the younger generation. But actually, if they're directly confronted with the harmful effects, then quitting increases, especially if they've been affected like negatively, like if they found out that they're at high risk for lung cancer, or they're on the rise of developing COPD, they're more likely to quit. And then when offered the appropriate tools, older smokers quit at rates comparable to younger smokers. So we just need to keep that in mind as we work with the older generation, and not have assumptions about that, and realize that a lot of them do want to quit as well. And then just also keep in mind that most likely with older adults, you're probably going to be working with older adults who are smoking, and not so much with vaping, even though there are a few who will be vapors also. Okay, so another indicator of smoking is specifically with women. So 35% are more likely to develop smoking-related illness compared to men, and women who smoke may take longer to get pregnant. They have a harder time quitting than men. And when you're working with women, you need to address the non-nicotine reinforcement when you discuss the tobacco cessation with them. Women have fewer long-term benefits with just NRT, so the nicotine replacement therapy, if it's not combined with other medications and psychosocial treatments. And women may need more intensive behavioral and other pharmacological support when quitting. So for every 10 cigarettes a nursing mother smokes, the baby will take in the equivalency of 1 cigarette. So something to think about when you're working with women who are smoking, who are also breastfeeding. So 7% of women reported vaping during their pregnancy, and 1.4% during the last 3 months of their pregnancy.
What's the supply for secondhand smoke?
So with secondhand smoke, it does affect individuals. So there is a risk of developing asthma, and with the baby as well, it makes it harder for them to breathe. So just like an individual, or any individual with that, right? And then with vaping, they always make sure you clarify that it is an aerosol and not water vapor, as a lot of people like to claim as it was when it first started coming out. Yes. So, and they also have to remember is, even though you go away to smoke or to vape, but when you come back in, it's on your clothes and it's in your hair, and so the baby will still breathe that in as well. All right, so another indicator is poverty. Individuals with the highest percentage of smoking behaviors are working class, low income, and low educational levels. The less quit attempts are due to reduced support for quitting, stronger addiction to tobacco. They have a lack of confidence in quitting, failure to recognize the potential to harm, and higher risk of not completing their pharmacotherapy and behavioral support. So the homeless population, their smoking rates are 3 times higher than the general population, and many clinicians working with this population will defend their tobacco use as personal freedom. So that's one thing that I'm working against with that, and also educating clinicians when you're working with your clients as well, and letting them realize that it's not necessarily like a personal freedom, and having them help your clients with that. So 41% of homeless services organizations offer tobacco cessation services. However, many shelter employees wrongly believe that quitting tobacco would increase client suffering, and so they would actually go out and buy tobacco for these individuals. And so more research needs to be done for definitive conclusions with vaping, but some research reports that more educated smokers are more likely to switch over to exclusive e-cigarette use than a less educated individual. All right, with sexual orientation. So smoking prevalence is 21% higher for lesbian, gay, or bisexual adults than for heterosexual. Lesbian women are more than twice as likely to engage in tobacco use regardless of age. Gay men at 18 are 80% more likely to be current smokers. Gay men younger than 50 are 60% more likely to be current smokers. And per the Behavioral Risk Factor Surveillance System survey, the prevalence of e-cigarette use among LGBT adults was nearly twice that of heterosexual adults. You'll see here in the next slide, which is really sad when you talk about tobacco companies targeting towards certain individuals, certain groups, is they actually had, it was called product scum, and the tobacco industry had a marketing strategy that targeted towards gay men and homeless individuals. Like, how sad is that? And so between LGBT young adults are ages 18 to 24, nearly twice as likely to smoke as their straight peers. And then the tobacco industry has spent millions targeting the LGBT community. So that's another thing, working with individuals in this population is you'll see that they have a higher rate of using tobacco. And so working with them with cessation and helping them to overcome that as well. Okay, so another indicator is addiction to other substances. So people with alcohol dependence are 3 times more likely to use tobacco. Tobacco is a strong predictor in use of illegal substances. People who are treated narcotic addicts, those who smoke, die at an earlier age compared to those who don't smoke. So what helps to accomplish cessation? Okay, so let's pick up each of these pieces. So one is tobacco-free policies in your working environments. So at discharge, 50% of smokers thought tobacco-free policies help them to address their tobacco use. Benefits to the client: increase the quality of life, decrease disease, disability, and death, and decrease hospital admissions. So the benefit to the employees is that it increased productivity, increased job satisfaction, decreased hospital admissions, decreased absenteeism, yes, there you go, and decreased presenteeism. So youth cessation, right? So one of the things that I was asked was, okay, what types of cessation are out there you can use to work with different clientele? So there's a lot of different things that we use with youth in schools that can also be used in the community. So this is one, and it talks about using with students, but it can also be geared towards working with youth in treatment as well. And this is called Catch My Breath. So you can go to this website. I can't go any further on it because it will ask me my students and who all is in my class and things like that. But this is something that you can look into. But it talks about the dangers of nicotine and e-cigarettes, and it offers like in-class activities, education, online resources. When you go to the next slide, you'll see a little bit about how it has the different PowerPoints. So if you are working with youth in treatment, then this is one course that you can use. So another option is the Stanford Tobacco Prevention Toolkit. You'll hear this a lot, and it's geared towards schools and community. So if you want to between the two, and this one might be something that might be more appealing for you. And it also has different presentations like PowerPoint, but also very interactive for the youth as well. Another one would be from the American Lung Association, and it's called In Depth. You can go online and become trained in this. It doesn't take very long. It addresses the teen vaping problem in a more supportive way, and it's a very interactive program. So the goal of every program is to educate students about nicotine addiction and cravings, and ultimately guide them through the process of identifying their own reasons for chewing, smoking, and vaping tobacco products. And this can be either used on a one-on-one or in a group setting. And if there are 4 50-minute sessions with this, and if you go to the next slide, you'll see the 4 different sessions. So first of all, you talk about getting the facts, talk about addiction, you talk about alternatives, and then you talk about the next steps to avoid your tobacco-related problems. So this is also a great suggestion to use with working with youth in treatment if you're trying to help them to quit their tobacco use. And this is something that the state offers for youth, and it's called My Life, My Quit. It's a free and confidential service. They can enroll, and you get the parents' permission once they are enrolled. So if they're in actually long-term treatment with you and not just coming for day treatment, this might be a little bit trickier how to use. You'll have to work through how that's going to work. But a lot of youth prefer this because it is more of a texting online thing. And also, again, when they're in long-term treatment with you, they don't typically have their phones. But this is just another suggestion for you to think about. Another way for you, just for some more information for you to get, is another website that the state has come up with, and it's called See Through the Vape. And it just gives you a lot more information of how to work with youth and to understand more about how to talk with them about vaping and how to work with the parents in educating their youth about vaping as well. This is Quitting. This is from the Truth Initiative, and this is geared towards the youth and young adults, and it works with seeing the good and the bad, and it helps young people feel motivated, inspired, and supported through their quitting process. And so this is just another option out there for them. Okay, so let's talk about adult cessation. So we have the Way to Quit, right? So here in Utah, so with adults, with this, they can get the free NRT, and this is very helpful for them. And they also can have that quick coach if they prefer. They just updated their website. There's a lot of good information on there for an individual who wants to quit. Information for you to know how to help an individual, like what you can say to offer support, and then you as a clinician of what you could say to help somebody through this process as well. All right, and then dimensions. So some of you here are working with this program. Is that correct? Okay, that's what I understood. All right, so where are we at with time? Okay, so this is where I was hoping that we could get into more of a discussion with this, because that was my understanding when I was asked to give this presentation, was to lead up to where you guys are at with this program. So as to offer suggestions for youth, because there was not a lot, they feel with the youth, but now even working with dimensions. So what do you, what is working with the Dimensions program? So those of you who've been working with it. Or how many of you are working with it? Or does nobody know what I'm talking about?
I'm not sure how to answer that question. I know that we have 2 employees on the substance use side of Wasatch that are certified in the Dimension program. And they are using that in some of their groups, like in our residential setting and also in outpatient treatment.
Okay, so it's just those 2 that are
Certified in.
okay. So most of you don't know about Dimensions. Then is that what I'm understanding? Okay, all right. Well, then let's back up and let's go about this a different way. So Dimensions is an evidence-based program, and you do have to get trained, like those 2 have been trained. But now, my understanding was that they were going around and training other individuals, so that's why I thought more of you were teaching it. All right, so we've been trained to teach this program. So there's 6 different modules with this. And so it's a tobacco-free, and it's with individuals in substance abuse treatment. All right, so we've been teaching this for quite a while. So those of us here at the health department, we were helping those who were in your treatment centers. And then when the treatment center at the county moved over to Wasatch, then those individuals got trained as well. So then they've been working with the program with that. It's been very successful with that, and there's a lot of benefit with this program. It doesn't necessarily address vaping yet. We've been adding in vaping, even though like technically you should be following that, but they are in the process of updating, and we should have a new manual within the next 2 years about including vaping.
I just have a few specific questions, maybe 3 questions.
Okay.
One is this, what's the format, meaning is this with individuals or is it in groups? And then is it curriculum based where you have like a workbook and you work through the workbook? And then what's the time frame of this?
Okay.
And the context is Jordan and I, we're working on the youth and young adult SUD team. We're doing mostly individuals with the youth, but we are doing group and individuals with the young adults right now.
Okay, so with the youth,
and the great majority use nicotine products.
Okay, so with the youth, you'd want to use one of the other programs that I suggested. Okay, so this would be more towards the adults. So we were using it we're in group setting. All right, so it is geared more towards like a revolving door, but we have treated it as so you are in treatment, and so we were going in, and so it's like 6 weeks. You can also ask the individuals who are teaching it over there at Wasatch how they are doing it. But how they had asked us to do it is we would go once a week for 6 weeks, and then we would take a break for like 3 to 6 weeks depending, and then we would come back again. Okay. But technically it is a revolving door, and so like somebody could start like at week 3 and then continue on, and then go 3, 4, 5, 6, 1, 2.
And you guys have been doing this for several years.
Yes, we have
partnership.
Mm-hmm.
Okay.
Yes, but now that they are trained, they have taken it more on, and we're more of like a resource. Yes, so they are able to actually train you to teach this. We can also work with them in training you to use this program as well.
Can I ask, who are the 2 people who got trained?
Alicia Shoup and Tammy Olson.
Oh, great.
Yeah. Mm-hmm.
That's great.
Who's usually doing these classes? Is it a therapist? Is it a nurse? Who usually does these classes?
So Alicia is a social worker. What is Tammy's?
They're both case managers.
Okay. Yeah. So, I mean, because I've worked with Tammy quite a bit over there at Foothill. I just didn't know what her actual title was. Yeah. And then myself, I'm a health educator. But yeah. So those who, like when I did our training over the summer, there were a lot of individuals who worked in treatment centers. So they're case managers, social workers, the mental health counselors, things like that. So yeah. Any other questions about the program? Oh, sorry, you asked about the book. So you have this little manual for you as a facilitator, and you just go through it, and you have little, it's kind of lessons that you have, and you just print these off, and you go through them with the clients or through each group, right? So they're just different papers, and it's supposed to be more of a discussion. So you just have little prompts that you would talk about, hand out the papers, and then have them fill them out, and then you go through the discussion with them with that. So for example, like this one is talking about defining your values, and then it says determine your most important values, review the list of values below, identify 10 values that are most important to you. So then they would, and then you would discuss that with them. So like a couple other ones would be like talking about stress, talking about their triggers. So what activities trigger them, environments, people, feelings. Talking about a tobacco-free journey, what they would need to help them on their tobacco-free journey. Talking about feelings and how to deal with their feelings and accepting the feelings that they have and being okay with that. And once they do decide to quit or cut down, how to handle different situations that they're in.
Do you guys do this course to the community at large? Like if a person just wants to...
So this particular program is geared to individuals who are in treatment.
Okay.
And with individuals, also with individuals with like a mental health disorder as well. Yeah.
Okay.
So we have been asked about classes for individuals out in the community, and so Freedom from, or American Cancer, or sorry, with In Depth. So they did have one, but it was $25 per individual, and a lot of individuals, like they couldn't afford like the $25. And so it was really hard to get up a community class going. But there has been talk about individuals wanting to do like some type of community class. And so that is definitely something that's been brought up a few different times. And also there's been individuals in treatment who want to come up with something where their partner could be involved as well. And we've talked it over with Alicia, but we have to be careful of their with privacy with that as well. Okay, so I just had a few other questions, but most of you obviously couldn't be able to answer this, but so I had asked like, what did you feel was not working? So, but some of the things that some people might feel would be kind of hard would be, what if they're not ready to change? How do you handle that? Because sometimes we go in and they feel like, well, I'm being forced to do this and I don't want to quit. And a lot of them have that kind of that attitude and that opinion, and that's just fine, right? And we're not here to force anybody when we were teaching these classes. So just some thoughts is just to be open-minded. Don't pressure them to change. I think most of you understand this from working with them already. And meet the client where they are. Celebrate the small wins, right? As you work with them, maybe they waited like 5 minutes longer than the last time, right? Celebrate all those little accomplishments with them. Validate their experience. Encourage people to talk about reasons they may want to change their health behavior, and they can still benefit by learning more about healthy living. And what's interesting is even though no one is forced to quit, majority of them, by the time we get to the 5th lesson, a lot of them have started to change their mind and have started to cut down. Along with this, especially with this new curriculum, is they emphasize more about motivational interviewing. And some individuals are a little confused with that or have some questions. I felt like most of you probably would feel okay with that, working in the scenario that you are working in, but I just brought these up just in case. So express empathy through reflective listening, develop discrepancy between clients' goals and values and their current behavior, avoid argument and confrontation, adjust to clients' resistance rather than opposing it directly, and support self-efficacy and optimism. And then, how do you feel that the health department could partner better with you there at Wasatch?
So work with the youth and the young adults. I know we've wanted to get a case manager for about 4 years, and we got one. Hey, I think it'd be great. Just putting it out there. Maybe we could get Suzanne trained, because it's a thing. We have all these people quit these drugs and alcohol and stuff, and then a bunch of them end up dying later from the nicotine. So just putting that out there.
Okay. All right. Yeah. So, we could get in contact, and obviously, at least for the young adults, those who've been trained over at Wasatch can help you and train for dimensions. With the youth, we can help give you more resources and help them to get them trained in using one of those programs, and to figure out what program they feel like is going to be best with the youth that they are working with. Yeah. And what other ways do you feel? Yeah, go ahead.
Would they ever be able to travel to our facility? Like I'm at Aspire and all the gals there struggle with that. Is that something, or would you want us to have our staff get trained, like one of them at Aspire?
So as in us from the health department be able to travel? Mm-hmm. So so what it would look like would be us going and training you. So we work with you with the first 1 or 2 times teaching it. So we're train the trainer. So we're training you to teach this, and then you would start doing it on your own. So at the very end, you'll have my information. So get in contact with me, and we'll work with you to get something set up with that. Yes. And are you here specifically in Utah County?
Say again?
Are you here in Utah County?
Yeah.
Okay. I just found out a friend of mine from Heber is in here as well. So I was just wanted to make sure. Okay. Yeah. Any other questions?
So are you volunteering to go to Heber too? Is that what you're saying?
No, I'm pretty sure my boss would not allow that. But I'm sure we could get something. But I think Alicia was to train somebody in Heber. Is what I thought she told me the last time I spoke with her. But we can work on.
You can Zoom it.
We can figure something out with that. So, are you currently in Heber?
No, I was just wondering.
Oh.
Since you mentioned.
So, all right. Any other questions?
So I'm just gonna be slightly vulnerable, just a little bit. And I don't know the answer to this. So I struggle with, they come in and they say, hey, I want to work on my weed thing. I'm like, okay, yeah, great, let's get to work. And they're like, hey, I want to work on my alcohol thing. I'm like, that's good, yeah, that's great, you know. And then sometimes they'll say, hey, I want to work on my nicotine thing, and then in my head I'm just like, maybe, you know, like that'd be great. Like if you really want to, I'll certainly help you. But just like that bias of like is there, and I mean I try to be aware of it and I try to work with it, but I'm also, you know, it's there. So I'm just bringing that up.
So you're wondering, like, do they really want to?
Well, some do, right?
Uh-huh.
Yeah, some get excited and they really want to quit nicotine, and like, you know, I feel like I'm there for them. But like where it said like the clinicians have the bias where they're not as likely to bring it up.
Mm-hmm. Yeah, with the older adults.
Well, even the teens.
Mm-hmm.
You know, like let's say they got charges for weed and they got charges for alcohol, maybe something else, and like, I mean, sometimes I think it's maybe 90% of my clients are using nicotine, but I don't spend a lot of time there, and I don't push there a lot because a lot of times I'm trying to pick my battles, and I don't want to be like confronting them a lot because they might disengage or.
Mm-hmm.
I'm just putting that out there. I'm not saying we have to solve it today, but I'm just saying it's there.
Mm-hmm. It is, yeah. And working with teens with tobacco cessation is not easy, right? And especially with vaping, and you have to meet them where they are with that. Really, anybody, you have to meet them. But maybe this might help encourage you a little bit. So, you know, why is it that you do what you do, especially with tobacco cessation? So, individuals who treat their addiction to tobacco and other substances at the same time, they're 25% more likely to sustain their recovery. And that's one of the reasons why we promote dimensions so much. And we've seen that. And Elisa can talk about that as well. Like, we've seen so much success. And if they're able to quit their tobacco use the same time that they're overcoming their other substances, they actually stay in recovery a lot longer with that.
Can I make one more comment? I know I'm saying a lot. I found that especially true with stimulants. For sure with the stimulant, like very correlated.
Mm-hmm. Yeah. So 75% of clients believe tobacco treatment should be offered while in treatment for other addictions. And tobacco treatment at the same time as addiction treatment does not exacerbate psychiatric symptoms and does not negatively affect abstinence from other substances. And a lot of individuals would go back in and see Alicia, and they're like, why didn't you offer this class when I was here, right? They're like, this is so great, and I wish I had this class when I was here, you know, in treatment. And it has had a lot of success with that. So just to reiterate, not one cessation tool works for everyone. Be flexible to tailor to your audience. But when you are working with them, be willing to address both the addiction and the habit. And then the Public Health Service Clinical Practice of Guidance says the best strategy for helping someone is a combination of counseling and FDA-approved cessation medication. However, for the NRT for an individual under 18 is not advised. So if a doctor and a parent works with an individual under 18, like that's between them, but like I myself, and I work with teens, like that is not something that I could suggest to them and offer to them. So that's not something that is readily advised or available for individuals under 18. Okay. Any additional questions? And then you can also just bring up my information so they can take that down and so we can get in contact. But any other questions that you have, or is there anything else that I could address? Or is there anything else you feel like you want me to touch on?
I really like the comment about celebrating small successes because you know, I've heard people say, you know, I quit. You ask them when they quit smoking, and they say, "Oh, I quit yesterday," and then, "Oh, I quit last week, and I quit last month, and I quit." You know, it's like, yeah, that's okay that you quit over and over because you're quitting. You know, you're getting there. So I think that's very important. To remember that it's a process for a lot of people.
Exactly. And, you know, and sometimes it's just it's just cutting down. And a lot of times it's like, we're the hardest on ourselves, right? And we think that we can't be successful until we get to the top of the mountain, right? But really it's like, oh, I made it to that tree. I made it to that rock, right? And it's just like, it's the little things that you've done. It's the same thing with treatment, right? It's this little thing that you've done, and you want to look at it that way as well.
Yeah, some at Vantage Point, Sarah, you come out a bunch of times and taught our kids, thank you. But we get a few kids that come through that are like so addicted to nicotine, right? And they say that, and they like, I'm going through withdrawals with nicotine, right? And but they specifically ask for like Nicorette or nicotine gum. What's your opinion on that? Like for youth to use that to help them? And I mean, I've seen it help for some kids. Other kids are just like, I don't know if they're just wanting it for like attention or whatever, but I don't know. It seems to help like in those kind of withdrawal moments. And how do we access that like for youth and for adolescents? Do they just ask their doctor for it, or?
So that would be something you'd have to bring up with their doctor, because technically, I would have to say, like, that is not something that would be recommended. Yeah. Like, I couldn't say stand up here and recommend that. So that would be something to bring up with their doctor and them, and an individual situation, and talk about it case by case that way. Yeah. So, because anyone under 18 technically should not be using the NRT to help them to quit. So, yeah. So a doctor can make that decision with that. So, but yeah, and you also, as you know, you have to look it over, you know, with youth. Are they just using that for attention? Are they using that just to get their nicotine hit because they can't be vaping right now, right? Because, you know, you took their vape away and they're in treatment with you, right? So are they using it as like an excuse, or is it really helping them? And again, it's an individual case by case, as you know, with each of them and how they're acting with that. Yeah. So, and I just realized that I didn't put up a slide, but people do ask about is vaping, and we're about done, but is vaping a good way to help you overcome your tobacco use?
Didn't one of your slides earlier say that if you were vaping, you'd be more likely to smoke later?
It did say that, yeah. But I was gonna put another slide in there about that, because that is a debate with that. Have I seen some individuals actually quit using a vape? I have, right? But is it like approved? No, it's not. And what is recommended is like, even though there's no like evidence with that, is that they switch completely over to vaping, and that they use it and they go down, cut down on their vape with the nicotine until they're no longer using it, right? So, but if you can use other methods to help you to quit, then that is what's recommended. But you'll hear that in your classes as well, and so people will bring that up. But yes, I have seen individuals, as I taught this, who have quit with a vape. But most of them, they don't. They either just switch over to vaping, and then they vape a lot more than when they were smoking, or they become a dual user. So, yeah. But any other questions? Okay, well, definitely take down my information, and we'd love to be able to connect with you to see how we can help more. So either getting you guys trained with dimensions, with you with going back up there with the youth and figuring out like a better class with these, and then working like with you guys as well. We'd love to be able to figure something out. All right, thank you.
I think